Welcome to the Healthcare Channel. We'll talk about 9 warning signs and symptoms in this video that could point to the presence of potentially fatal blood clots in your body. Normally, blood clots form in your body and are expelled during the day. However, on rare occasions, if they don't dissolve, they may become stuck in your arteries or veins. This can restrict blood flow to and from your heart, which is risky since it can lead to serious problems including a stroke, embolism, or heart attack. When a blood clot breaks off and lodges in the lungs, it can cause pulmonary embolism. If you encounter any of the symptoms covered in this video, it is imperative that you consult a physician as soon as possible. Symptoms of blood clots. 1. Walking cramps. Walking cramps, also known as claudication, are brought on by potentially dangerous thrombi that can develop in the arteries or veins in your arms or legs. Those who smoke, are overweight, or have diabetes may be at higher risk of developing these clots. A blood clot could be the cause if you walk and feel cramp-like pain in your leg muscles that goes away when you rest. Usually, these pains start after you walk the same distance repeatedly and go away when you relax. Your arm or leg muscles may enlarge, and there may be a red, warm patch if there is a blood clot. 2. Sharp chest pain. Another term for the severe soreness in the chest is pulmonary embolism. Breathing difficulties, severe chest pains, and abrupt dyspnea can all be symptoms of a blood clot in your lungs. This happens when a blood clot breaks off from a blood vessel that is deeper in your body and makes its way to your lungs, where it obstructs blood flow. Because it keeps enough oxygen from getting into your bloodstream, this is very harmful. Make sure you get medical assistance as soon as possible if this happens. 3. One-sided numbness. Another term for numbness on one side is an ischemic stroke. Think about how your brain regulates your entire body and how it needs a good flow of blood and oxygen to do its job. Sometimes a clot might block your brain's blood supply, which can cause a stroke. People who have restricted arteries due to plaque accumulation are more likely to experience this. One side of your body may suddenly become paralyzed. Your face, arm, or leg may feel numb or weak. You may also have trouble speaking or understanding. You may even feel dizzy, and since your brain isn't getting enough oxygen, your head may hurt a lot. In the case that this happens, don't hesitate to visit the emergency room to get help right away. 4. Basketball belly. Hepatic venous thrombosis, another name for basketball belly, is a disorder when blood clots clog your body's blood arteries, which function as miniature highways. These clots can affect the liver's ability to function and produce ascites, a condition that makes your abdomen feel confined and swell like a basketball. This can happen if they lodge in the veins of your liver. But keep in mind that liver issues other than blood clots can also cause this stomach problem, so you should see a doctor to find out what's wrong. 5. Arm pain. Arm pain, or coronary thrombosis, is a dangerous ailment that needs to be treated right away. As your heart is a strong muscle that needs a steady flow of blood, sometimes a clot might obstruct a blood vessel that supplies your heart, causing a heart attack. If this occurs, you might feel nauseous, lightheaded, and even start to perspire in addition to having excruciating chest discomfort that radiates down your left or right arm. It would be greatly appreciated if you could like this material, subscribe to my channel, and enable notifications for the most recent nutrition and health tips. 6. Loss of vision. Retinal vein occlusion, also known as loss of vision, is a condition where the blood vessels in your eyes resemble small pipelines. Occasionally, a clot can clog these pipelines, causing you to wake up with blurry vision in one eye or experiencing sudden vision loss. This type of clot may not cause any pain, but you may also notice a dark spot in your vision. This is a serious condition that requires medical attention as it may lead to further problems with your other eyes. 7. Irregular heartbeat. Atrial fibrillation is a term used to describe an irregular heartbeat. An irregular heartbeat can occasionally cause blood to build up in the heart and then move to the brain, increasing the risk of a heart attack or stroke. If you have atrial fibrillation, a condition called by the same name, you should be closely watched. It might happen as a result of a neurological system issue. 8. Swollen feet. Expressive feet or swollen feet. Have you ever noticed how your ankle and foot skin stretches out and gets really puffy? This could mean that blood flow around your foot isn't as good as it should be, which raises the possibility of a blood clot forming. Your skin might also look shiny or have a tiny depression in it when you press on it. You may, however, take steps to assist, such as exercising, taking B vitamins, and ensuring your body gets enough of the essential elements. 9. Varicose veins. Your legs may have twisted, blue veins known as varicose veins. They appear when the veins weaken and there is insufficient blood flow. The body's elevated estrogen levels may be the reason for this. The likelihood of a blood clot forming when blood gets stuck in varicose veins is higher. This can occasionally be a sign of a more serious condition called deep vein thrombosis. I hope you like this video. If really, then make sure to subscribe to our channel and press the bell icon for more videos. Thanks for watching and have a wonderful day. Stay tuned with us for more videos.